Of the opposition.
Liberal inflation has sent food, housing, and gas prices soaring, but there's one substance that has gone down in price by 90%. Powerful opioids. After the Prime Minister announced $100 million.
I'm sorry, I'm going to interrupt the Honourable Leader of the Opposition. Can you start from the top? We're just getting some distractions from all over. From the top, please. Order.
While the Prime Minister has sent inflation for gas, heat, and groceries soaring, there is one product that's actually come down in price: powerful opioids. The Prime Minister has spent $100 million on so-called safe supply. One Global News reporter went into the street to find out where all these drugs are going. Turns out they're being resold to other addicts in order to raise the money to buy deadly fentanyl. Will the Prime Minister cancel the dollars for drugs and instead put the resources into treatment for addicts?
The Honourable Minister for Mental Health.
Mr. Speaker, we are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology of the past. Even Harper's advisor, Ben Perrin, thinks they're speaking nonsense. So just stop it and save lives.
The Honourable Leader of the Opposition. The Honourable Leader of the Opposition.
Speaker.
Order. Order. The Honourable Leader of the Opposition.
No common sense. The evidence is seen in the tragic faces of addicts who lie overdosed on the pavement in the downtown east side of Vancouver, where after this Prime Minister spent $100 million handing out free drugs to addicts, he has led to a 300% increase in overdoses. Will he stop giving dollars for drugs and instead follow my common sense plan to put the resources into treatment and recovery to bring our loved ones home drug-free?
The Honourable Minister. Order. The Honourable Minister.
People are dying. Save.
One second. Order. 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 One person at a time in this chamber, please. The Honourable Minister.
46,000 overdoses have been reversed in safe consumption sites. That member says that he will stop that. I want him to speak to the parents of the people that would have been lost if there weren't safe consumption sites and safer supply. This is ridiculous.
The Honourable Member for Cumberland Colchester. Honourable Leader of the Opposition.
That people are dying because that minister and this Prime Minister are flooding the streets with dangerous drugs and killing these people. Since they brought in this policy, there has been a 300% increase in drug overdose deaths. 30,000 people have lost their lives. Investigative journalists have shown that the drugs that she is funding with Canadian tax dollars are flooding the streets and being sold for $1.
Order. 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 I'm hearing yelling on both sides. Please. The Honourable Member for, the Honourable Leader of the Opposition from the top, please, so we can hear the whole question. And I don't want to hear any screaming or shouting in the background. And then we can hear an answer as well. The Honourable Leader of the Opposition.
People are dying because the policies of this Prime Minister are killing them. His policies are flooding the streets with drugs that now go for $1 a hit. You can buy 26 hits of hydromorphine, which is an analog to heroin, for $30, Mr. Speaker. These are drugs paid for by Canadian tax dollars under a program by this government that has led to a 300% increase in drug overdose deaths. Why won't they get some common sense, end dollars for drugs, and put our people in treatment?
The Honourable Minister for Mental Health. Order. The Honourable Minister for Mental Health.
People have to stay alive long enough to get treatment. People are dying because of a toxic drug supply. Safe supply allows people to stay alive long enough. It means that in the CMAJ study just yet... Order.
Please start from the top, the same courtesy I gave to the opposition leader.
People have to stay alive long enough to get to treatment. People are dying because of the toxic, tainted drug supply. When people are on safe supply, the CMAJ article yesterday talked about less drug use, less overdoses, less petty crime. This is an evidence-based project and program that it meets the test of evidence and science, not a journalist who only will speak to the people who disagree with him.
The Honourable Leader of the Opposition.
The theory is that if you flood the streets with hydromorphine, an opioid, that then people won't use more dangerous fentanyl. The reality...
Okay, we want quiet on both sides. We want to go back and forth. I just want everybody to take a deep breath, and we want to hear the question as well as the answer. The Honourable Leader of the Opposition from the top, please.
The theory is that if Prime Minister puts $100 million of hydromorphine on the streets, that people won't use more dangerous drugs. The reality, in both reports from the National Post, the Globe and Mail, and the data from the ground, is that the addicts are taking the hydromorphine, selling it to kids, taking the profits to buy fentanyl, dying of overdoses. The kids then get bored of the hydromorphine, and they take deadly fentanyl. That's why people are dying. Will the government stop the policies that are killing people and put our people in treatment instead?
The Honourable Deputy Prime Minister.
Mr. Speaker, some things are just beyond the pale. Our Minister of Mental Health is one of the most respected members of this House. Unlike the Leader of the Opposition, who is a career politician and has done nothing else, she is a doctor. She devoted much of her life to delivering babies and bringing forth life. I heard the Leader of the Opposition shout across the aisle, "You are killing them." Shame. That is shameful. That is entirely unacceptable. Sad.
The Honourable Member for Cumberland Colchester.
Mr. Speaker, it's utterly shocking that this Liberal government believes the only treatment for addicts in this country is palliative care. No other treatment required, just move straight to palliative care. Since this reckless plan using taxpayer dollars for high-potency drugs was introduced, 7 people a day, Mr. Speaker, 7 a day in January alone in BC have died. The overdose crisis cannot be fixed by giving people more drugs. It's only making it worse. When will this Liberal government realize that the Conservative common sense plan to give addicts rehabilitation and not free drugs is the way to end the overdose crisis?
The Honourable Minister.
Mr. Speaker, Canadian drug policy and international drug policy have all 4 parts: prevention and education, harm reduction, treatment, and enforcement. We lived through 10 years of this Conservative government taking harm reduction out. We are now having to build back. And as Ben Perrin has said, rehashing Conservative war on drug tropes that have since been discredited and have been found not to be only ineffective, but costly and deadly.
The honourable member for South Surrey, White Rocks.
Mr. Speaker, the Prime Minister says that spending tax dollars to give free hard drugs to addicts is safe. He is wrong. Instead, he supercharged the drug crisis that is killing our sons and daughters, 7 dying in BC a day alone. There is no time to wait. We need a common sense plan that saves lives. Stop flooding our streets with crack, heroin, and cocaine. Addicts need rehab, access to treatment beds, and a path to a drug-free life. The Prime Minister is out of touch, and our youth are at risk. Will he do what it takes to bring home our kids drug-free?
Yeah! The Honourable Minister.
Mr. Speaker, we can't allow the Conservatives to take us back to the failed ideology of the past. Our government will use every tool at our disposal to end this national public health crisis. Supporting safer supply is just one of the evidence-based comprehensive public health responses to the toxic drug and overdose crisis. It does include prevention and treatment and enforcement. Our government is working with stakeholders to help support safer supply and build that evidence, like the recent CMHH study around this promising practice and life-saving practice.
Honourable Member for Louis Saint-Laurent. Mr. Speaker, even though this situation has been raging across BC and all of Canada, Canadian parents and families are concerned by this issue. What we've seen, Mr. Speaker, is that for years under the Liberal government, the situation has been getting worse. Not only is it not getting better, but it's getting worse. They must notice that it's time for a new approach, an approach that's based on common sense. The Honourable Minister of Health.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. And I want to thank my colleague from Quebec for the question. I think, like me, he knows that there are people in my riding and across Quebec who are working to save lives through treatment, early intervention, harm reduction, and also through supervised injection sites. These are people that I would invite my colleague to visit. Many of them are in Quebec City. Their approach is very different than the ideology of his leader. They're there to help people.
The so-called safe supply policies of the Liberal NDP coalition are deadly. 7 people a day are dying in BC alone. Unsafe tent cities abound. Kids are being sold the safe supply drugs and overdosing at an alarming rate. Then users have the cash to buy deadly fentanyl. Our sons and daughters are paying the price. When will these Liberals make treatment beds a priority, not free hard drugs, so we can bring home our loved ones drug-free?
Yeah. The Honourable Minister for Mental Health.
Mr. Speaker, once again, I will quote from Ben Perrin, the Public Safety and Justice Advisor to former Prime Minister Stephen Harper. There is no indication that prescribed safe supply is contributing to illicit drug deaths. Safer supply has been tested and found to be beneficial for people who have been unable to have treatment for whatever reason and are long-term substance abuse users. We talking about essentially substituting a contaminated street drug with a drug that has known contents and potency to help people stay alive, first of all, and also to be able to stabilize.
Honourable Member for Cumberland Colchester.
Mr. Speaker, the careless attitude that this Liberal government has taken towards the overdose and addiction crisis in Canada is unacceptable. In British Columbia alone, as I mentioned previously, Mr. Speaker, 7 people a day are dying in January. We have heard the Liberal Addictions Minister refer to the reckless distribution of hard drugs without mandatory treatment as a, quote, necessary step. When will this Liberal government listen to science and realize that their decriminalization experiment is a failure and give addicts rehab, not free drugs, and bring our loved ones home?
Hear, hear. The Honourable Minister.
Mr. Speaker, Speaker, it is impossible to bring your loved ones home if they're dead.
Order. Order. Please continue.
The toxic drug supply means that people in construction, in the mines, are using once and dying. We have to move to a safer supply of drugs like we have with alcohol and cannabis and the other ways that people actually use substance to numb their pain. Former Prime Minister Stephen Harper's advisor said, as particularly people using drugs as props. I was really disgusted by it. I hope I was so disturbed to see Pierre Poilievre.
Next question. I was order. The time had run out long before. I just want to remind the honourable members when they're referring to someone, refer to them by their titles or their writings. I know it gets emotional in here and we forget sometimes, but I just want to remind everyone on all sides. No. I have another name.